Hello, beautiful people. How you all doing today? I hope you are fine. I hope you are well, wherever you're watching me from. Welcome back to the channel. If this is your first time watching my video, please do consider subscribing to the channel. And don't forget to like, to share, to subscribe. Again, I'm saying subscribe, please. And in today's video, we'll continue from where we stopped. Remember, we started a series on the female breast. And already we've talked about breast pain. We've talked about nipple discharge. So in today's video, we'll talk about breast lump or a breast mass. So a breast lump is a growth or a mass that develops in the breast. And most women, they are understandably frightened upon discovering a growth or a tumor in their breast. Note, I use the word understandably because you expect somebody, a growth was not in your breast before, all of a sudden you can now find a mass in your breast. Of course, it's normal for you to panic. It's normal for you to worry about the breast, about that kind of growth, because it's strange to your body. So, in today's video, we are going to talk about some conditions that can cause lump in the breast, and they are not cancer. They are not cancerous. Most of the tumors that are found in the breast, or most of the growths, most of them are usually and normally benign. Benign means that it's not cancerous. Most of them are not cancerous. But then we can also have cancer. But when you have these benign masses or tumors or growths, they do not increase your risk of developing breast cancer. And it's very rare for them to progress into cancer. Note that I said it's very rare does not mean it cannot progress. So don't get me wrong. Like I used to say, this video is to educate us. It's for educative purpose only. It's not for diagnostic purpose. You know yourself. You know what is normal for you. So any deviation from the normal, please go and see your doctor. Okay? So some conditions that can cause lump in the breast and are not cancer. Number one, the first one I'll talk about is fibroadenoma. Fibroadenoma is quite common. It's usually painless. It's unilateral. Unilateral means that it's found in one breast and it's benign, not cancerous. Fibroadenoma is usually found in younger age women from around age 14, 15 to around 35 years. And the exact cause of it is not known, but it's thought to be due to hormonal influences on our breast tissue. So it's actually a solid mass. It's solid. And if you are able to discover it, it's usually mobile. So it's not like confined to a particular spot or particular it's not location. So if you move it, it can move around. And around the borders are usually very smooth. That is fibroadenoma. Again, it does not increase your risk of developing breast cancer. Most times, it doesn't require any treatment. It will go away on its own most of the time. But sometimes, if it continues to grow bigger and bigger and bigger, and maybe cause deformation, it changes the shape of your breast, your doctor may recommend that it should be removed. But most times, it shrinks and just disappears on its own. As for fibroadenoma. Next one I'm going to talk about are cysts, CYSTS, or breast cyst. Maybe just one, and it may be a cluster of cysts. So it's like a sac that is full of fluid in the breast. A sac that is full of fluid. So clear fluid in the breast. Again, this one is common as well. Just that it's found in like older age group. Not like over 60s, but at least like, let's say from about 35 or 40 upwards. And then again, it does not increase your risk of developing breast cancer. And then really again, it can progress into cancer because there is a kind of cancer, breast cancer, that is called intracystic intracystic cancer. That is, inside the cyst, that's intracystic. Inside the cyst, a cancer can develop. But again, it's very rare. I've said it before, that some of this condition that causes the benign breast lump, it's rare for them to progress to cancer. But that does not mean that when something is rare, does not mean it cannot happen at all. So I hope you understand that. Again, a breast cyst usually will not require any treatment. It will shrink and disappear on its own. Or sometimes, if it doesn't go away, the doctor may do something they call fine needle aspiration. They will just drain the fluid. So that's another one that can cause a mass in the breast, and it's not cancerous. But that does not mean that it cannot progress to cancer, because I've told you that the cancer can grow inside that cyst, but it's very rare. Another one is fatty necrosis or fat necrosis. So we know that in the breast, there are a lot of fatty tissues there. When I say fatty necrosis, necrosis means death of a tissue. So it means that area, that fatty area of the breast, it means it's dead or it's damaged. So it can just form a solid mass in the breast. Because when there's a solid mass, then that's a lump, and it can come. You may mistake it again for cancer. That's another one that can cause breast lump. Another condition that can cause breast lump, and it's not cancer, is intraductal papilloma. Remember, if you watch the video on nipple discharge, I talked about this intraductal papilloma. So it's a growth that develops inside the milk ducts. That's why it's intraductal, inside the ducts. And because it's a growth, of course, it will feel, when you palpate the breast, it will feel like a lump. And this can also cause nipple discharge. I've talked about it in that video. So if you haven't seen that video, please do well to go and watch that video. Again, intraductal papilloma does not increase your risk of developing breast cancer. So these are some conditions that can cause lump in the breast, and we may mistake them to mean cancer. However, because as an individual, you cannot tell which is which, so you don't know. Even your doctor, by just looking at your breast, does not know. The doctor cannot say, oh, it's likely to be this. They have to do, there are a series of tests that they have to do, and then they will be able to tell you, okay, this one is not cancer, this one is fibroadenoma, this one is this one is that. So that's why I said, when you notice any of these changes in your breast, you need to go to the hospital. So I've talked about 4 conditions that can cause lump in the breast, and they are not cancerous. Now let's talk about the breast cancer itself. So what are the things that we can watch out for? The ones that are cancerous, they are usually, like I talked about, in the other ones, they are mobile. Those other lumps that I've talked about, they will move around. But in the case of cancer, it will not move. It will just remain on that particular spot. In the case of cancer, again, the edges or the border around this lump is usually irregular. It's irregular. Please, when you notice any of those changes, go to the hospital. Then there are some nipple changes that you can see. And the thing about breast cancer is the lump may have even been growing like for years without you even noticing. Because some of these lumps I talked about, some of them are so tiny that even with your hand, just by palpating, you may not be able to discover them. Yeah, but for those ones that are big enough for us to be able to feel, so these are some of the things that you watch out for. Like I've said, the cancer is usually confined to one spot. The edges are irregular. There are some skin changes that you will notice on your breast as well. For instance, the nipple, you have inverted nipple, so the nipple looks like it's turning inward. You can have bloody discharge from your breast as well. So you can have inverted nipple, you can have bloody discharge. The skin of the breast will start changing. It will start changing. So the skin of your breast may become darkened, or sometimes it looks like, when you are peeling orange, the way they peel, what it looks like, you may have that same kind of look on the skin of your breast. When you notice any of these changes, it actually indicates that there's likely cancer going on in that particular breast. And so when you can see these changes, inverted nipple at the speed of light, because it means that it's even already getting late, you know. So don't wait till things get out of hand before you go to the hospital. So when you notice any of these changes at all, whether it affects one breast, it affects two breasts, you're breastfeeding, you're not breastfeeding, please, women, let's pay attention to our bodies. And if you notice anything, so if you know what is normal for you, when there is a deviation from normal, you will know, and then you'll be able to go to your doctor. So I hope you've learned one or two things from today's video. Please make sure you subscribe to the channel. Kindly share this video with your friends, with your brother, your sisters. You may say, why are you my brother? Yes, your brother has a wife, he has a fiancé. So do consider subscribing to the channel too. Thank you very much for watching. I'll see you in my next video. Bye.